So we'll hope for the best here. So welcome to the Department of Nursing Preview Day. I'm going to have to be very patient and only click once, otherwise it advances beyond where I want to be. I'm going to show you a couple people on here. This is our Associate Dean of Undergraduate Nursing, Dr. Joan Owens. She joined us last time. She is not here today. She's amazing. She is a nurse. She's an administrator. She's a very kind person, and we all decided to give you a fun fact about ourselves. And so she was supposed to run the New York Marathon this year, which got canceled. And she decided not to do it virtually. So I thought that was pretty cool. That's very difficult to get into. Okay, the next one is me. Again, my name is Cindy Durgan. I am a graduate of Gonzaga, and I'm the program coordinator for the undergraduate program in nursing. I have a bachelor's degree in business and marketing, and then I got my master's at Gonzaga in organizational leadership with an emphasis on servant leadership. And so my fun fact is that I was born in Hawaii and that I try to get back as often as I can. And I just saw that it opened up again yesterday. So that may be sometime in my future.
And I'll just start talking.
Good plan, Marcy.
I know. I'm Marcy Kennedy Coulter. I am the freshman and sophomore nursing advisor. I advise you for your first 2 years when you enter Gonzaga. I have been an advisor for 3 years here at GU, and I've been a program coordinator for undergraduate nursing for 10 years before that. And I graduated from GU with my master's in organizational leadership, and I have a bachelor's in anthropology from UC Berkeley in California. But my fun fact is I climbed a 12,000-foot mountain not too long ago, Mount Adams over there in Seattle. So welcome everybody. I'm glad you're here.
I can see the presentation is again moving at a sales pace. So I'll let you guys introduce yourself as well.
I'll go first since Maddie just hopped in. Again, I'm Claire Silva. No need for much time, but just glad you're here. And our admission office is really here to help you through this admission process and talk about nursing admission and all. We will cover that in our admission session, but know that we're just here to help. And go ahead, Maddie.
Hi, everyone. My name is Maddie. I am also an admission counselor. I work with students from Oregon, Southwest Washington, and Montana. And like Claire mentioned, we'll just be hanging out in the chat, trying to make sure you get all of your nursing related questions answered. So thanks for being here.
Hi, I'm Mara. I'm a current nursing student. I'm a sophomore this year, and I'm also here just to provide a student perspective and answer any questions you have. So I'm so glad you're all here.
And Mara's in her lovely dorm room, I might tell you, which is directly across the street from Tilford Hall, which is where nursing students go.
I have a beautiful view of our nursing building. It's lovely, so everybody wave.
Okay. Very slow. Okay.
Here we are. Okay, so the Department of Nursing, we just wanted you to know that it, like the school, University of Gonzaga, it's grounded in our Jesuit and nursing tradition. Our Bachelor of Science in Nursing will focus on community reflection, servant leadership, social justice. The nursing department believes they shape the future of healthcare by, providing our students, undergraduate and graduate both, with your nursing education, which is going to be rigorous, very innovative, relevant to what's going on in the world, and grounded, of course, in Jesuit and nursing values. So we prepare our nurses to practice in like today's very complex healthcare environment.
So I'm going to jump in and just give you kind of an overview on the NCLEX, which is something everybody who wants to be a nurse wants to be sure that they're going to a school that gives them a good opportunity to pass that NCLEX exam. So I would share with you that our the way that they do these runs from October to April and then from May to October. So they're kind of a funny time period in terms of how our graduations line up in December and May. So we do not yet have the May 2020 statistics. I actually think I just got them in my inbox yesterday, but I haven't opened them yet. But our pass rate for our May 2019 graduates was at 100%, which is awesome. And the national average that particular time period was 87%. And our pass rate for our December 2019 graduates was also 100%. And again, the national average was 87%. So we do a good job prepping our students for NCLEX, and that starts really when you start your upper division coursework at Gonzaga. They begin prepping you for being ready to take that exam when you graduate. So just a little bit of history about the undergraduate and the graduate programs at Gonzaga. They started at different times. So the first programs that we had at Gonzaga were our Master of Science in Nursing program that we brought on board in 1978. And that encompasses our family nurse practitioner, our psychiatric mental health nurse practitioner, and our health systems leadership masters. Then we also offer a very unique degree called RN to MSN. So students who have just an RN, which would probably be a 2-year only degree, can apply to the RN to MSN program, and they would jump over their bachelor's program and receive a master's degree in nursing. So unique program, they take 4 bridge courses that help them to be prepared for the master's level courses, but it's pretty unique. The BSN program, the one that you're interested in, came on board at Gonzaga in 2006. Then shortly thereafter, we brought on our DNP, which is doctor nurse practitioner. And then after that, that was in 2013, we added in our DNAP, which is Doctor of Nurse Anesthetist program. It actually was around longer than that, but it became part of the School of Nursing in 2015. It's a very difficult program to get into. It's actually housed up at Sacred Heart. They only take about 12 or 15 students a year. And for that, they get about 150 applications per year. So it's very coveted. There's hardly any of them in the western half of the US. So it's a very popular program for students. Oops, I think I just messed that up. I think it's going to go to the next slide, so I'm going to have to go back here. You're going to have to bear with me for a second because it's going to make me start all over again, and it's so slow. So let me go back. I guess we'll just start over again. Sorry about that. I'm not used to this program taking so long to respond, and so it's quite disconcerting to have to constantly monitor my click level so that I'm sure that I'm not leaving something out. And then I just skipped Marcy's slide for her, which was terrible.
Actually, that's fine.
You want to start talking about the core, Marcy, while I get there?
I can tell you about the core. You know, in addition to, of course, now I don't have my slide in front of me, of all the other courses that you do take for nursing, the university requires you to take certain core classes each separate year that you're there. And they like you to get a well-rounded education in global studies and writing enriched programs, and also social justice. And the nursing program provides so much already of social justice, but we do have one class that's especially geared toward social justice, and that's Nursing 251. But you'll be taking history, literature, art, and 2 classes in religion, Christian Catholic and world religion. This all lines in with your program. We try to space these classes out mostly in your freshman and sophomore year. And we do have an ethics class and a world religion class that will come in your junior year. And now in your senior year, mostly you just have nursing classes, but you do have in the year 4, you do have your core integration seminar. And for nursing, it's healthcare ethics. So mostly, let's see, well, I think I might have covered everything. But you can see year 1, 2, 3, and 4, there are just different things that we concentrate on. And you see us when you come in as freshmen, it's mostly reading, writing, communications, your bio 105, chemistry will be in there. And then the second year, you just focus on, well, you'll be taking philosophy 201, human nature, and a Christian Catholic class. Your third year, like I said, you'll be ethics and world religion. And then your fourth year, you will focus on this core integration seminar. And then the broadening courses are fine arts and design, history, literature, and social behavioral science, which is like Psych 101. So those are all, and they all tie in well with nursing. Not all of them, so you have to kind of, this does give you a chance to kind of branch out and take something besides nursing, actually. So that's a nice thing. And then your designations that I talked about, writing and rich, global studies, social justice, we make sure that you have a rounded education in those as well.
Thanks, Marcy. Well done without the slide, by the way.
Hey.
You'd think you worked with that every day.
Yeah.
So I'm going to talk just a little bit about your pre-nursing courses that you'll be taking in your first 2 years at Gonzaga. So you're going to be working on your biology and biology lab, microbiology and lab, and chemistry and lab, as well as those psych and soc, statistics and nutrition, and then anatomy and physiology 1 that also has a lab, and anatomy and physiology 2 that also has a lab. And those are the ones that people tend to be the most worried about. Mara says she's in A&P right now. So she's thumbs up. She's got great instructors. We were just asking her who she was taking it from. So that's the one people get nervous about. So if you've had the chance to take A&P while you're still in high school, it's a great foundational course to be able to come in and have some of that information at your disposal when you start in those classes. Step 2 in those pre-nursing classes, in the nursing classes, would be the ones that you're going to take that will prepare you while you're still in your freshman and sophomore year for the upper division classes. So intro to nursing, growth and development, and then social determinants of health. So those all come in years 1 and 2. And so obviously you don't take one each term. Sometimes people decide to take intro to nursing and growth and development at the same time. Sometimes they break them up, one in the fall, one in the spring. So there's differing ways that people do that. So I'm going to talk a little bit about how we do a cohort model here. So when you apply to Gonzaga, you come in the fall of a year. And when you start as a freshman, you will be taking some of those science classes up front. You will, in the spring semester of your freshman year, you will get the opportunity to say, I would like to be on the 8 semester plan, or I would like to be on the 9 semester plan, which I'll talk about in a second. So the 8 semester plan, obviously you would finish up in 4 years. You would take your nursing, your prerequisite, and your core, and then your final 4 semesters, you would take your upper division nursing classes. So how we choose those students, I'm going to talk about the 9 semester next, and then I'll tell you how that people decide. So that would be in the first 5 semesters, you would be at GU. So that would be fall, spring, and then fall. If you were a 9 semester student, you would take again your nursing prereqs, your university core, and some courses of interest that you might have. So students that choose the 9 semester plan do so for a couple of reasons. They want to do a study abroad in the fall before they start in the spring, their upper division classes. So they can do study abroad, they can perhaps work on a minor, they could slow their progression down. They could just take some more courses of interest that they might have. They also could choose to take a leave of absence and get some job experience. So they'll apply to do, varying positions in a hospital to try to get some work experience. And then you do your final 4 semesters of your upper division nursing courses, just the same as the 8 semester plan. So what happens in that spring of your freshman year, we'll be getting ready to do this in late January, early February this year. Students will say, I'm interested in doing the 8-semester plan. I want to do the 9-semester plan, because they already know they want to do a study abroad, a minor, or slow it down a little bit. And so we bring in about 90 students, 80 to 90 students in the fall of your freshman year. And then you make that designation. And then we then look at your science grade that you've achieved in that fall term of your freshman year, as well as your overall GPA, in order to try to best balance that out so that we have an even split between our 8 and our 9 semester students. We are restricted by the number of students that we can put into clinical classes when you get into those upper division classes, because we only can have one clinical faculty member with 10 students. So that's when it becomes important that we keep those numbers separated. So we couldn't keep the whole cohort of 80 or 90 together, so we break them up. And so Marcy and I sit down and with our associate dean, and we look at the students who said, I want 8 semester, the students who said, I want 9 semester, and then what happens to the 8 semester students if we don't have enough space. That's when we use those GPAs, your science GPA, as well as your overall GPA, to break that up. And so the students who would choose the 8-semester plan and get it would start in the fall of their junior year in their upper division classes. And those students that choose the 9-semester class would have that fall term to do either the study abroad or take minor classes or take a leave, and then start their upper division classes in the spring of that year. So that's how we break up that 8 and 9 semester cohort. It sounds a little confusing in the beginning, but it's really designed to help keep those clinical numbers down so that students get that experience. Mara, which plan are you on?
I'm an 8-semester nurse.
Perfect, thank you. So we're going to take a little bit of a look at what happens when you get to those courses in your junior year. And so the first semester you're in your upper division classes, you start on you do 2 rotations in a clinical setting. So you would do a pediatrics, and then you would also do a geriatrics rotation. And so in the past, what that's included is doing health screenings at the area Catholic schools, and vision, hearing, that sort of thing, and then going into our long-term care facilities to assist in the geriatric setting. All of that's been a little different with the COVID. So our students this fall are doing their pediatrics a little bit differently. They're working with families at Catholic Charities and doing some screenings there. That's an organization here in town with lots of places for students to help people in Spokane. And then we have one long-term care facility that's allowed us to come in. So this semester, the students are doing, instead of doing all of their pediatrics first and then all of their geriatrics next, they're going 2 weeks in pediatrics and 2 weeks in geriatrics. So they're going back and forth. And then they spend time in our simulation resource center, where you can see our PAT patient right there being attended to by the sim director, Dr. Susan Edwards, and then a couple of the nursing students in their scrubs. So the first term you're in your upper division classes, it's fairly broad. And so what it does is it starts you with less acute, and as you move through your upper division classes, you become working with more and more acute type patients. The second semester of your junior year, you would be doing, you're moving into more of the clinical setting in the hospitals. So you're going to work in a medical surgical environment, focusing on care of adults. Women's health and newborns is another rotation, and then a community mental health component comes in as well. And again, every term you move forward, you start to work with having to make more and more decisions as it relates to greater and greater care of the patient. The first semester of your senior year, you again, focusing on, you can see the courses are similar. You're focusing now more on acute care. So your medical surgical care of adults 2, pediatrics 2, so working with maybe students in the NICU, more difficult type cases, and then acute psychiatric mental health rotation. So again, just advancing your care every term you're here. Your final semester as a 4th semester senior, you start with that community health practicum that Marcy was talking about. And then you do your senior practicum, where what you'll do is you can notice the pathway that this person is walking on. They're going to ask you to decide where you want to concentrate your practicum. So if you have an interest in pediatrics, you may go and work in a pediatric setting. If you want to work in geriatrics, you might go to a geriatric facility. You want to work in medical surgical, you're going to go there. And you would work one-on-one with the nurse for, I think it's about 6 weeks. Is it 6 weeks or a month, Marcy?
I thought it was maybe 8 weeks. So
8 weeks.
it's around there, yeah.
And so you're following whatever their particular schedule is. So you mirror them and you're working with them very closely. And so it gives you that experience so that when you leave Gonzaga and you take your NCLEX, you have that practical experience to hopefully move into that area that you'd studied in your senior practicum. So it gives you some really great experience in the field you're hoping to go into. So a little bit about our clinical innovation. So what we do is we run our, you notice from the traditional model that clinical instructor has, say, 10 students working with them. That's pretty typical. We use what we call a dedicated educational unit, a DEU. And so it's pretty much, it's a 1-to-2 ratio. It's not really a 1-to-1. And we do a combination of the traditional model and the DEU. So you can see in the DEU model, the faculty mentor would be like your, the course instructor. And then there are clinical staff instructors that are in the care of the facility where you work. And they will then be working with 2 students. So much more concentrated than having the clinical instructor working with 10 students. We do a blend of the 2. It requires that you work the nurse's schedule, like that practicum that we were talking about. It's the depth of the learning that you're going to get and critical thinking. And so it's a little bit different than a lot of programs, but it's very concentrated and it allows for a lot of great hands-on experience. Marcy, do you want to do the study abroad? You probably have the best handle on that.
Study abroad is a really popular option for our nursing students. I'd say probably a quarter to a third of our nursing students do go study abroad, and whether it's going to be a full semester or just a summer. A full semester, you would take 5 classes. A study abroad, you can also incorporate a minor into your program that way, which is a popular thing to do. We have a lot of psychology minors that and foreign language minors that can be completed in this semester abroad. A summer abroad is also good. You can do a summer abroad and be an 8th semester student, and you take 2 classes out of your program and take them abroad. We have so many different places to go. Glasgow, Scotland is a popular one. You can take 2 classes there, Nursing 210, which is growth and development, and your Christian Catholic religion class can be there as well. So that would be just 1 summer abroad, and you would be an 8th or a 9th semester student to do that. Summer abroad, you can do it one of 3 summers while you're there at GU. So it gives you a kind of a bigger variety of times you can go. If you're going to go a full semester, you would go in the fall of your junior year. That's really the time that we can accommodate you to be away for a whole semester. You would finish all of your first 2 years of prerequisites for the nursing program and the core classes, most of the core classes for the university. And then you would take 1 semester and go abroad and then come back and begin your upper division nursing courses. Let's see what else. There's so many variety of places to go. You would just have to check with global engagement and see how many different opportunities there are. I will tell you most nursing students like to go to our Florence campus. We do have a lot of students that go there. So that's a very popular place. Spain is also popular. I think we have New Zealand as well, and London. So, I mean, there's just, we have Africa. We do have a program, 2 classes in Africa. So there is a lot to explore for that option.
Thanks, Marcy.
Yeah, I have a question in the chat that I thought would be great to answer out loud from Sophie. Will the 9 semester plan end up costing more than the 8 semester plan?
It's covered. Go ahead, Marcy.
Go ahead. No, you got it, Cindy. I didn't say anything.
It's covered by financial aid. So there is a way to work that out. Yes, absolutely. The cost of a course of study abroad is going to be, you know, your travel and anything you want to do while you're there is going to be an additional cost for you. But again, that's accommodated by financial aid.
So basically your financial aid and scholarships will extend for that additional semester.
Correct. So this is our simulation center and learning lab. We just did a comprehensive remodel on our building, and we had our simulation lab was on the main floor in Tilford, which is our building. And we expanded down into the basement also. So we still have the main floor area for practicing, but then we have our sim center and learning lab down in the basement. And this is, of course, Pat, patient. He can be programmed to do all kinds of things. He's pretty amazing. And the students practice. The window that you can see behind here is when you're going through your testing, there's somebody behind there watching you, and they have programmed the patient to have various episodes that you've practiced on, and how in real time you're responding to those symptoms and signs that the patient is in distress. They give you the medical cart with medicines. They teach you how to dispense those. The biggest difference is they use candy in those. And so I've offered to eat all the extra candy that they can't put into the machines. So I'm kind of missing that right now that I'm not down there, but they use like any different color candy they can to simulate different medicines. So, but it's a great practice tool, and it's really a lovely facility that they put down there. It's quite lovely and gives you great practice. So just a general overview of the degree requirements. Our Bachelor of Science in Nursing is 130 credits. Again, the 8 or 9 semesters. You need to have a 3.0 GPA in order to enter your upper division nursing classes. And we require a 2.0 to be able to graduate out of the program. You also have to maintain a 2.0 or a C grade or higher in all nursing and nursing prerequisite courses, or they need to be repeated. And then there's varying requirements in the nursing program about how many times you can repeat a course and where you need to do those. And so all of that's something that you'll learn about a little bit more in depth. This is where some of our graduates are employed and their positions. So they are concentrated in many, many different areas and in many different fields. So you can see Swedish Children's Medical Center here, Georgetown University Hospital, Mayo Clinic, Oregon Health Science University Hospital, some of these. And then you can see some of the positions they're doing. They're doing emergency, they're doing obstetrics, pediatrics, hospice, school nurse, traveling nurse, outpatient, lots of different things, ICU. So lots of different areas that our students go into. And we've had really good success with the students who do their practicum, get that experience, and want to move into that position, going to the position that they want to get. So gives you a good feeling to know that if that's your end goal, then all that practical experience is really going to pay off. And now we're down to just any questions, general questions that people might have for whomever you would like to ask them to.
So feel free to unmute yourself, or if you want to type them in the chat box, that's great. And if there's not one initially, Mara, would you mind sharing briefly your experience within the nursing program? I know you're a sophomore, but just briefly.
Yes, of course, I would love to. So when I decided on Gonzaga, I wasn't even sure that I wanted to stay in the nursing program specifically. I was like, oh, I mean, I'll apply, but I might switch to a different major later on. And honestly, then in my very first semester, I was like set on it. As soon as I met like the nursing faculty and the advisors, it was just so clear that it was like the place that I wanted to be. And I've had so much fun in all of my courses so far. Hi, Mara. Sorry, I see questions in the chat. What made me choose Gonzaga over all the other schools? Again, because I wasn't completely set on being in a nursing program, that wasn't really a part of the decision for me. Mostly for Gonzaga, it came to the larger sense of community and the sense of balance within Gonzaga. And also the financial aid that they offered was just another great pulling point. Yeah, so that was a big thing of it. Anyway, there
Thanks,
are,
Mara. Oh, go ahead.
oh yeah, sorry. Yeah, if one of you wants to answer more of the financial aid questions specifically.
Yeah, so Cindy talked about how many students are in the nursing program, around 80 or 90, correct? So we admit more than that because students are applying to more than one school. So students will, go to other nursing programs. So we have about a 30 to 35% acceptance rate, probably closer to 35% acceptance rate into our nursing program. So it is our most competitive program because it's so amazing. And we're so glad that you're interested in our nursing program. So when we're evaluating students for admission, we're looking very closely at your curriculum and your preparation for within the sciences, and we're wanting students to be successful within the program. And so we're looking at that preparation and that you've done within high school. There was a question about average GPA and ACT. I would like to note we are test optional for Gonzaga for 2021, and that includes our direct admit nursing program. And so you do not have to submit an SAT or ACT. Though if you are considering submitting that, you can. Our middle range ACT is between a 25 and a 30 around. So if for ACT, between a 1200 and a 1350 or so is our middle ranges. But if you want, you can talk to the admission office. If you have more questions about that, we can set up an individual appointment. And I'm looking in the chat here. What's the best part of nursing at Gonzaga? Mara, I don't know if you wanted to chime in, or nursing Cindy and Marcy, if you wanted to chime in.
I think my favorite part about the nursing program is that it's rigorous while still being it's not cutthroat or overly competitive. It's just students who genuinely are interested in what they're doing and are passionate about learning more. And then it's also so fun with your cohort. You really do build such a strong community because you're going through a lot of the same classes together, even from freshman year. And so now most of my roommates are also nursing students. And so that's just been so fun to sit at the dining room table and study for A&P on a weekday. And so, yeah. That's what I would say.
Clara, could you take on the question about international students for as far as being eligible for financial aid and scholarships.
I was just typing it. Yes, international students are eligible for merit-based scholarships, and there are. Please review. I'll put Maddie, if you put a link for the scholarships page in there, you can review information on our scholarships. Yes, we do have some.
So I'm seeing a question here about options for advancing to the nurse practitioner at GU. Yes, there are some people who jump over a master's and they go directly to the DNP program. And so you'll want to just be sure that you do get some good practical experience. It's not common for students to be admitted into the DNP program right out of college, because they like you to have some practical experience. I used to work in graduate admissions, and so that one is I'm confident in answering. So, but you don't have to have a master's degree to apply to the DNP program. Eventually, you will want to have maybe a couple years of practical experience. I also see a question about nurse anesthetists. Again, the students that are applying to the nurse anesthetist program it's very competitive. So you'll be eligible to apply, but again, it's probably best to get some practical experience before you try to apply to that nurse anesthetist program, because it is so highly competitive. And you'll want to be sure you give yourself the very best opportunity. The gentleman who runs that program up at Sacred Heart would be happy to probably weigh in on opportunities that you could look at for how to give yourself the best opportunity to apply to that program. But again, it's just incredibly competitive to get into. Not to dissuade you at all, because it's a great profession. It's a highly paid profession. So that's probably why it's so competitive to get into. Let's see if there's another one here.
I think the question about are you able to have a regular job and be in the nursing program?
Katie, I can answer that for you. I have a job. I'm in the nursing program. It works out fine. Upper division wise, scheduling gets, I think, a little more difficult. But from what I've heard from my upper division friends, some of them do have part-time jobs, and it's more flexible hours, I would say, that you have to look for. But in lower division, it's very, very easy to work part-time.
Thank you. As far as quality traits that we're looking for nursing students, really we're looking for students who are academically prepared, as well as students who are involved and engaged in their community in many different ways. It doesn't have to, there's no one size fits all answer. We just, and we know that right now there are challenges for students getting volunteer opportunities in hospitals and clinics. And so we are looking at kind of the whole picture. We take a holistic review of your application. So we just want to know a bit about who you are and what you're involved in within your school and within your community, with your family, and what that looks like. So don't be modest on that application checklist. And like I said, there's no one size fits all. So I say it's the academics and then the overall picture of kind of what you're involved in and what you're doing. So I hope that helps.
Marcy, do you want to answer the question regarding the 8-semester plan and being in the honors program?
We do have honors students in the 8-semester plan, and the honors program adds in a number of credits, so it's going to be a more rigorous and in-depth program for these honor students, but they can do it. Nine semesters just stretches it out, but I think most of the honor students do prefer an 8-semester program, and that's what I've seen them go into. So the answer is yes.
Yeah, so I'm in the honors program, and my experience is that the advisors, so you'll have an honors advisor and then your like nursing advisor, and they're both so like ready to work with you and work out a schedule that's going to get all of your necessary credits in. So
And there's a question in the chat about race and gender diversity in the nursing program, but I'd like to call out this being kind of our last question. We're going to wrap up at 12:10. And then I'm going to put a link in the chat. I'd love for you all to click on that link, and that will, after our 10-minute break, we will have our student panel, which I hope you all are able to sign into, and that starts at 12:20. So please join us for that. So we'll put a link in the chat there. But Marcy or Cindy, do you have stats on that? Or
I don't have them off the top of my head. I do have them available, so I would just have to do a little bit of digging. I am going to type in my email address in here. So Sophie, if you want to get back to me on this, I can do some digging on that. And there's my email address, and just send me an email and I'll be happy to get that question answered for you. That goes for everybody else. If you have questions after this is over, Marcy, if you want to type in your email address there as well, then we're always here to answer questions for you whenever they pop up. If they're admission related, we generally swing you back over to Claire and Maddie. If they're just straight up admissions questions, if they're nursing questions, then we're happy to take those on in our either Marcy or I or Joan.
great, thank you. So Maddie put the Zoom link for the next meeting in the chat, but I also put the web page. So if you're having trouble signing into 2 Zooms at the same time, definitely click on that student panel. You can always go back to the main session that you're in. Great question. As far as a nursing applicant, we accept first year students only, meaning you have to be a senior in high school to apply. Transfer students, we don't have a space for transfer students to apply to our nursing program. You find out at the time of admission if you are admitted into our nursing program. So it would be in your acceptance packet. Great, thanks for putting that. And then each of you have an admission counselor dedicated to your school. So please reach out to us, and we are more than happy to talk about nursing, but also just admission in general and what that process looks like. And just again, we are grateful for you spending part of your Saturday with us to learn more about Gonzaga. So reach out as much as possible, and we want to help you get the information you need. So thank you to Cindy and Marcy and Mara. We appreciate you as well.
Thank you, Claire.
Yes.
And everybody, thank you.
All right. Enjoy the rest of your Saturday, and we'll see you at 12:20 for the student panel, everybody. Thanks so much. Take care.
Bye.
Bye.
Thank you.